Hello everyone, welcome back. This is the fourth and last video of this series, Science in Radiology. So let's see some more science in radiology. So what we are seeing here, so this is CT angio, sagittal section, and this is the VRT image, which is showing cerebral aneurysm. So this is berry aneurysm, which appears like a berry, and so this is saccular cerebral aneurysm, which is also known as berry aneurysm. What is happening here? So these are basically CT and MR images of a patient, which is showing cashew nut sign. So what is cashew nut sign? It is a radiological sign which is described in juxtacortical intracerebral hemorrhage. So it is just deep to the cortex and intracerebral cerebral hemorrhage because of cerebral venous thrombosis. So it is described in CT as well as on MR. On GRE sequence also we can see shape of the hemorrhage is like cashew nut. So presence of juxtacortical intracerebral hemorrhage is quite specific for cerebral venous thrombosis, typically seen in superior sagittal sinus thrombosis. What is happening in this MRI GRE sequence? So this is walnut kernel microbleed pattern, which is typically seen in cerebral fat embolism. And this sign, along with the star field pattern that we have seen in our previous video, is quite specific for cerebral fat microembolism. What is happening in this MRI brain axial T2 weighted image? What is this sign? This is concentric sclerosis, which is a rare and severe monophasic demyelinating disease, and it leads to formation of onion bulb appearance. So this is onion bulb appearance. It is because of multiple it is basically a subtype of multiple sclerosis in which rounded lesions appear with alternating layers of high and low signal intensity on MR. So it gives an onion bulb appearance, and the entity is concentric sclerosis. What is this sign? This is also onion skin appearance. It is because of multiple layer of periosteal reaction, and it is typically seen in highly aggressive uh, bone tumor like Ewing sarcoma. So this is a case of Ewing sarcoma involving femoral diaphysis, showing onion skin pattern of periosteal reaction, multi-layered pattern. What is happening here in this T2 weighted MR axial sequence showing posterior fossa? This is shrimp sign, which is a MRI marker of cerebellar progressive multifocal leukoencephalopathy. It is characterized by T2 hyperintensity in the cerebellar white matter, which is abutting but sparing the dentate nucleus. What is happening in this MRI axial T2 weighted sequence? What we are seeing here. So this sign is hot cross bun sign. So it refers to MRI appearance of pons on T2 weighted sequence in which T2 hyperintensity forms a cross. So T2 hyperintensity forms a cross on axial image, and it is because of selective degeneration of transverse pontocerebellar tract and median pontine raphe nuclei, and it is seen in multiple system atrophy, although it can be seen in other neurodegenerative diseases as well. Which sign is this? This is a chest radiograph, just showing snowman sign. So it is a sign which is seen in total anomalous pulmonary venous return type 1, which is supracardiac type, and it is also known as figure of 8 sign. So snowman sign is also seen in pituitary macroadenoma. So this is snowman or figure of 8 sign. What sign is this? Again, axial T2 weighted MR image, which is showing Swiss cheese pattern, which is because of diffuse enlargement of Virchow-Robin spaces. So Virchow-Robin spaces are basically perivascular spaces, and when they become prominent and enlarged, they can give an appearance like this, Swiss cheese pattern. So Schief's pattern is also described in pulmonary laceration. So this is a case of pulmonary laceration, which is showing multiple fluid-containing pneumatoceles, and this is again described as Swiss cheese pattern. So Schief's pattern is also described in polycystic kidney disease. Which sign is this? We are seeing a hand radiograph, and one of the phalanx is quite dense. So this is ivory phalanx or dense phalanx. It is because of increased radiodensity of the entire phalanx, and it is as a result of periosteal and osteal bone formation. So this sign is a specific radiographic manifestation of psoriatic arthritis. What is this? This is ivory vertebra sign, which can be seen in lymphoma. Commonest cause is Hodgkin lymphoma. Then it can be seen in other uh, diseases like osteosarcoma, osteoblastoma, and osteoblastic metastatic disease. What is this sign? This is pine cone bladder or Christmas tree bladder, which is a cystographic appearance in which bladder is elongated and pointed with thickened and trabeculated wall. It is typically seen in severe neurogenic bladder with increased sphincter tone or due to suprasacral lesions or epiconal lesions. Occasionally, it can be seen in bladder neck obstruction of non-neurological causes. So this is pine cone bladder, Christmas tree bladder. What is this? This is MRI knee, just showing suprapatellar region, suprapatellar bursa, which is completely filled with multiple uh, tiny, nodular lesions, which are completely filling this suprapatellar recess. So these are rice bodies, which are described as multiple small loose intra-articular bodies, which resemble rice, and they are located in synovial fluid, bursa, or tendon sheath, and they are classically seen in rheumatoid arthritis, but they can also be seen in infectious arthritis like tuberculous arthritis, and they can also be seen in juvenile idiopathic arthritis. So these are rice bodies. This is another example of rice bodies, but different disease. So these are rice grain calcification in cysticercosis. So Taenia solium infection in the muscles and in the subcutaneous plane, they can get calcified and they look like rice grain. So this is cysticercosis. Is there anything abnormal in this MRI brain? This is T1 weighted sequence. So as you can see, CSF is dark. So this is T1 weighted sequence. And we are seeing a lesion, a space occupying lesion here in the petrous bone. So this is salt and pepper sign. So salt and pepper sign is basically a typical MRI appearance of highly vascular tumors that contain foci of hemorrhage. So typically seen in paraganglioma. And this appearance is described on T1 weighted sequence, not any other sequence. And on T1 weighted sequence, we see two kind of signal intensities. So there are punctate regions of hyperintensity, which represent salt, and multiple small flow voids, which represent pepper, which are black. And this sign is typically seen in hypervascular tumor in this region, typically in paraganglioma, carotid body tumor, and pheochromocytoma. So this is salt and pepper sign. Salt and pepper appearance has also been described in skull radiograph in hyperparathyroidism. So it is because of multiple tiny lucencies in the calvaria. And so this is salt and pepper sign of skull or pepper pot skull. It has also been described in salivary glands in Sjogren syndrome. What is this appearance? This is a skull radiograph lateral view, which is showing raindrop skull appearance, which is because of calvarial multiple myeloma. What is happening here? Is there anything abnormal in this lateral chest radiograph? Yes. So we are seeing an abnormal area of soft tissue density here, which is giving Oreo cookie sign, which refers to presence of pericardial effusion on lateral chest radiograph. So we see a vertical oblique line pericardial fluid, which separates the uh, epicardial fat from the pericardial fat, and this can also be seen on CT. Oreo cookie sign has also been described in superior labral tear or slap lesions. What is this sign? This is blade of grass sign or candle flame sign, which is described in lytic phase of Paget's disease. So Paget's disease has three phases. In the lytic phase, you can see this blade of grass or candle flame type of osteolysis. What is this sign? This is track sign in femur, which is a normal appearance. So this is AP and this is lateral view of femur. And you can see this abnormal radiodensity. So this is a normal appearance. This is not something which is abnormal. And it is because of two sclerotic lines which run parallel along the long axis of bone. And it represents normal linea aspera pilaster complex, and it is an anatomical variant and it's not abnormal. So this is track sign of femur. What is happening in this MRI image? We can see a space occupying lesion of mass, which is showing multiple cystic areas with fluid level. So this is bowl of grape sign, which is described in synovial sarcoma. Bowl of grape or bunch of grape has also been described in many other conditions like in bronchiectasis, in chest, in IPMN, in pancreas, and in uterus in cases of hydatiform mole. What is happening in this chest radiograph? What we are seeing here is polyleaf sign, which describes the appearance of pleural plaque on chest radiograph, and it is defined as irregular shaped opacities and which are having thicker nodular edges. So this appears like a holy leaf. So these are pleural plaques. What is happening here? So this is CT temporal bone, which is showing broken heart sign or Y sign. So broken heart sign or Y sign is basically an appearance on CT temporal bone coronal plane, which describes incudomalleolar disarticulation. So incus and malleolus, they are disarticulated and they give a broken heart sign. Y sign has also been described in lumbar epidural lipomatosis. What is this sign? This is snowstorm appearance, which is described in complete hydatiform mole. Can also be called as bunch of grape sign or snowstorm sign. And this is another snowstorm sign which is described in. So this is basically ultrasound of breast region, just showing snowstorm sign in a case of extracapsular silicone breast implant rupture. So we have seen multiple signs which described intracapsular silicone breast implant rupture. And there is one sign that is snowstorm sign, which is seen in extracapsular rupture. What is this sign? This is because of intra bladder hematoma or multiple blood clots that give Sagadi sign. What is this sign? This is empty delta sign. So delta is basically a Greek letter which is shaped like a triangle. So this is a triangle, but this is empty as there is thrombosis here. So this is seen in dural venous sinus thrombosis, and this is basically seen in superior sagittal sinus, and this is described as empty delta sign. There is one more sign that is described in venous sinus thrombosis, and that is dense vein sign or cord sign. So as you can see here, this is dense vein sign or cord sign, which is showing central venous sinus thrombosis. What is this? This is another delta sign which is described in MRI knee. So this is double delta sign. As you can see, two triangles superimposed on each other. So this is seen in bucket handle meniscal tear. This is double delta sign. What is this sign? This is a shoulder radiograph which is showing snow cap sign or snow capping, which is described as dense sclerosis over the head of humerus or femur in a case of osteonecrosis. Which sign is this? This is Shepherd-Crook deformity, which is because of involvement of femur by fibrous dysplasia, and it can also be seen when Paget's disease or osteogenesis imperfecta affect femur. So this is Shepherd-Crook deformity. What is this? This is a barium solo, which is showing reverse 3 sign or E sign, which is seen in coarctation of aorta, post-ductal coarctation of aorta. So here we can see this is the narrowing in the aorta, which is seen distal to the origin of left subclavian artery. And there is dilatation of the pre-stenotic and the post-stenotic part of the aorta. And these dilated portions, they compress the esophagus and they give this E sign. This is another 3 sign which is described on a chest radiograph, again in a case of coarctation of aorta, but this is because of the coarctation itself in the aorta. So here we can see there is coarctation in the aorta giving 3 sign. What is this sign? This is a bone scan image which is showing abnormal uptake in the sacrum, which is giving Honda sign or H sign or H pattern, which is because of bilateral sacral insufficiency fracture. The bilateral sacral insufficiency fracture on radioisotope bone scan gives H sign or H pattern, Honda sign. This is MRI image where we can directly see the sacral insufficiency fracture. So this occurs in severe osteoporosis. What is happening here? So this is a pediatric brain situated sagittal image which is showing J-shaped sella. So here you can see the sella is shaped like a J, and it is because of flattening of tuberculum sella, which forms the straight edge of J, and dorsum sella, which remains rounded and forms the loop of the J. So this is J-shaped sella. This is a J sign which is seen in humeral avulsion of inferior glenohumeral ligament, also known as Hagel. What is this sign? So this is a fetal ultrasound antenatal scan which is showing twin peak sign or lambda sign, which is triangular appearance of basically chorion, which is insinuating between the layers of intertwin membrane, and this indicates the dichorionic diamniotic twin pregnancy. There is another sign that is T sign, which is seen in monochorionic and diamniotic pregnancy. So we have 2 signs, twin peak sign or lambda sign and T sign. So T sign is seen in monochorionic placenta, whereas lambda sign is seen in dichorionic diamniotic pregnancy. What is this sign? This is golden S sign, which is seen on chest radiograph, and it is also known as reverse S sign. And it is seen when there is central mass which obstructs the bronchus, predominantly upper lobe bronchus, and it raises the suspicion of primary bronchogenic carcinoma. What is this sign? This is subcortical U fiber sign or U sign, which is because of involvement of short association fibers and represents connection between adjacent gyri of brain, which are located within the cortex or immediately deep to it in the subcortical white matter. And these are among the last part of brain to myelinate. And these are predominantly affected in progressive multifocal leukoencephalopathy. What is this sign? This is a cervical radiograph lateral view, which is showing teardrop sign. So this is extension teardrop fracture. This is flexion teardrop fracture. So you can see this fragment is small. Here we can see there is more severe, displacement of the vertebral body, and there is a large fracture fragment. So this is flexion teardrop. Mode of trauma is different. This occurs because of hyperextension injury, and this occurs because of hyperflexion injury. And neurological involvement is more severe in cases of flexion teardrop fracture. There's one more teardrop which is described in pelvis. This is pelvic teardrop. and it is used to describe the Waldenstrom sign, which is measured, which is the distance between the pelvic teardrop and the femoral head. And if it is more than 11 mm, or if a right to left difference is more than 2 mm, it indicates joint diffusion. It's quite a highly specific sign of hip joint diffusion. So this is Waldenstrom sign. Another teardrop is described in this lateral ankle radiograph, which represents ankle joint diffusion. There's one more teardrop which is described in PNS radiograph, and it is because of fracture of the floor of orbit, and it is because of appearance of herniated intraorbital fat, which are actually protruding into the maxillary sinus, and it occurs in blowout fracture of the orbit. So this is teardrop sign. What is this sign? This is teardrop sign of basically it is because of change in shape of portal vein or superior mesenteric vein, which changes its shape from oval to teardrop, and it is because of tumor encasement or teeth ring by adjacent fibrosis, and it is highly suspicious of invasion of the vein by the tumor. So this is another teardrop sign. What is this? This is teardrop bladder or pear-shaped bladder, which is when the bladder is not normally round and ovoid, but it is compressed by extra vesical hematoma, pelvic hematoma, or pelvic lipomatosis, and then bladder resembles a pear or a teardrop. So this is teardrop or pear-shaped bladder. What is happening here? The axial T2-weighted cervical spine image, which is showing inverted V sign or inverted rabbit ear sign, which is a radiological sign described in subacute combined degeneration of spinal cord. What is this sign? This is frontal radiograph in a patient with perforated distal esophagus, and this is Nash-Larios V sign, which is seen as the air lucency outlining the medial portion of left hemidiaphragm and the lower lateral mediastinal border. So this indicates perforation of distal esophagus. What is this sign? So you can see multiple cystic areas in the lung which are surrounded by ground glass opacities. This is Cheerio sign. So it's a thoracic imaging sign which relates to pulmonary nodule with a central lucent cavity supplied by patent bronchus, and it is due to proliferation of malignant or non-malignant cells around an airway. So it is seen in lung adenocarcinoma, pulmonary Langerhans histiocytosis, and mesothelial-like nodules, and they can also be seen in infections and pulmonary metastasis or rheumatoid nodule. What is this sign? This is double donut sign, which is a radiological sign of viral encephalitis, typically due to dengue encephalitis. Like here, we can see bilateral thalamus showing double donut appearance. So this indicates viral encephalitis. Again, it has also been described in Japanese encephalitis. What is this appearance? This is a lateral chest radiograph, which is showing donut sign due to enlarged lymph node. So it is because of enlargement of right hilar, left hilar, and mediastinal lymph nodes giving donut appearance. What is this sign? This is a skull radiograph, lateral view, which is showing tram track appearance or tram track sign because of parallel calcification of cortex in patient with Sturge-Weaver syndrome. So it is calcification of the cortex in cases of Sturge-Weaver syndrome. What is this sign? So this is again tram track sign, which is seen in optic nerve sheath meningioma, and it has also been described in optic perineuritis, optic sarcoidosis, and pseudotumor. So this is tram track sign of optic nerve sheath meningioma. What is this? This is tram track sign of cylindrical bronchiectasis and a chest radiograph. What is this? This is CT temporal bone showing both right and left side comparison, and here we can see a normal ice cream cone appearance, and in this case ice cream cone is lost. So this is the normal appearance of ear ossicles, And when there is failure of this normal configuration, it suggests ossicular chain disruption and it indicates inguinal disarticulation. What is this? This is ice cream cone sign of vestibular schwannoma. So this is vestibular schwannoma, which is giving ice cream cone appearance on this post-contrast T1 weighted sequence. What is this appearance? This is candy stick or licked candy stick appearance. It is because of tapering of the tips of metacarpal bones and phalanges, and it is typically seen in leprosy or neuropathic joint, and it can also be seen in psoriatic arthritis or rheumatoid arthritis. So this is licked candy stick appearance. What is this sign? This is macaroni sign, which is seen in Takayasu arthritis on ultrasound. It represents smooth, homogeneous, echogenic circumferential thickening of arterial wall, which typically occurs in Takayasu arthritis. So this is macaroni sign. What is this sign? This is polo mint sign. So this is polo mint sign, and it describes venous thrombosis on contrast enhanced CT. It can also be called as mint with a hole. What is this sign? So this is orbital radiograph, which is showing black eyebrow sign. And black eyebrow sign is described on plain facial radiograph to represent intraorbital air. So air is lighter, so it settles in the non-dependent area and in a linear fashion, giving an appearance of an eyebrow. And it represents a orbital blowout fracture where air leaks from the sinuses into the orbit. What is this sign? This is stag antler sign or hands up or inverted Mostra's sign, which is seen in pulmonary venous congestion or pulmonary venous hypertension or in early phases of pulmonary edema. And it is because of prominence of upper lobe pulmonary veins. And this is the earliest sign of pulmonary venous hypertension or stage 1, grade 1 pulmonary edema. This is staghorn calculus, which appears like horns of the stag. And this is batwing pattern of pulmonary edema, which is late stage of pulmonary edema. What is this sign? This is atoll sign or inverted halo sign, which refers to focal ground glass opacity with a peripheral ring of consolidation, which can be complete or incomplete. And this sign was originally described in organizing pneumonia, but can also occur in infection, infarction, granulomatous disease, inflammation, and tumor. So this is atoll sign or reverse halo sign. There is often associated irregular and intersecting areas of stranding or irregular lines within the area of ground glass opacities, and this has also been called as bird nest sign. This is bird nest sign, and again reverse halo sign, which is in this patient. This is happening in invasive pulmonary fungal infection. What is this sign? This is axial calcification, and in breast on mammography, it represents benign peripheral rim of calcification. Typically, it is secondary to fat necrosis or calcification of oil cyst. And on radiograph, we see thin rim-like calcification, which is less than 1 mm in thickness, lucent centers, and small to several centimeters. They can vary in size from small to quite big. So typically seen in oil cyst. So this is the another case of oil cyst, and this is the CT showing axial calcification. What is happening here? So this is axial calcification of lymph nodes, and it is seen in mediastinum. So this is seen in anterior mediastinum. This is axial calcification, and basically this patient had a history of treated mediastinal lymphoma, and it is because of calcification around the lymph nodal mass. What is happening here? Is there anything abnormal in this abdominal radiograph? Yes. So here we are seeing a serpingeous area of calcification and tubular pattern. So this is Chinese dragon sign, which is a radiological sign on abdominal radiograph and CT. And it is because of calcified tortuous splenic artery, and it resembles a Chinese dragon. It's an incidental finding seen in elderly and diabetic patients. So that's all. I hope you enjoyed this series. Thank you very much.